How should patients be guided during pain flare-ups? The skill of activity adjustment. For individuals living with persistent musculoskeletal pain, flare-ups are an inevitable and often distressing part of their journey. During these periods of heightened pain, the instinctive patient response is frequently to stop all activity, engage in complete rest, or strictly avoid painful movements. However, this common coping strategy, while seemingly logical in the short term, can be highly counterproductive in the long term. Healthcare professionals must actively educate patients on the crucial self-management skill of regulation. While in some cases patients may need a day or two before they resume their regular activities if they experience intense pain with movement, for the vast majority of cases, it is all about adequately adjusting physical activity during a pain flare-up rather than stopping it altogether. This involves encouraging them to modify daily tasks, hobbies, and even formal exercise to prevent deconditioning, reduce fear avoidance, and maintain functional capacity. What should be considered when adjusting activity during flare-ups? 1. Risk of deconditioning and fear avoidance cycle. Prolonged inactivity or complete rest during pain flares might lead to rapid physical deconditioning, such as muscle atrophy, reduced endurance, or decreased flexibility. This physical deconditioning, combined with the belief that movement causes harm, reinforces fear avoidance behavior. The fear avoidance model posits that pain leads to fear, then avoidance, then disability, and further pain, perpetuating a vicious cycle of chronicity and worse outcomes. 2. Maintaining function and preventing catastrophizing. Encouraging adjusted activity during flare-ups helps maintain functional capacity and prevents patients from spiraling into catastrophic thinking. Graded activity and pacing for chronic musculoskeletal pain demonstrate that continuous engagement in meaningful activities, even if modified, improves self-efficacy, reduces disability, and can even shorten flare duration compared to strict rest. 3. The no harm, no damage principle. Pain during a flare-up does not necessarily indicate new tissue damage or injury, especially in chronic nonspecific pain. Educating patients that moving into some pain, within tolerable limits, is safe and beneficial, and helps break the ingrained belief that pain equals harm. And 4. Psychological resilience and self-efficacy. Actively coping with a flare-up by adjusting activities rather than withdrawing completely can build significant psychological resilience. Patients learn that flares are manageable events and not insurmountable setbacks. This enhances their self-efficacy in pain management, reducing helplessness and fostering a proactive mindset, which is critical for long-term well-being. How can you educate patients on activity adjustment during flare-ups? 1. Normalize flare-ups and reframe them. Refer to flares as common, temporary, and manageable increases in symptoms, not as signs of damage or complete failure. Use metaphors, such as a speed bump or waves, to reduce the emotional impact and perception of a setback. 2. Educate on the harms of complete rest and avoidance. Clearly explain the deconditioning and fear avoidance cycle. Help patients understand why stopping all activity may make things worse in the long term, causing loss of strength, increased pain sensitivity, and decreased mood. 3. Teach practical adjustment strategies. Pacing. Provide concrete tools for modifying activity. Examples include the traffic light system: green, go, normal activity; yellow, slow down, adjust activity to 50-70%; red, rest for very short periods, then minimal adjusted movement. Activity rest cycle. Break down tasks into smaller chunks with planned rest breaks before pain escalates. Reducing dose. Advise doing 50% of typical activity during a flare, or shortening walk duration, reducing the number of repetitions or the amount of weight, instead of stopping entirely. Focus on daily activities first. Emphasize adjusting chores, work tasks, and self-care before formal exercise, as these are often the most difficult for patients to continue. 4. Reinforce the idea that movement is medicine, pain is not harm. Consistently reassure patients that pain during movement does not equate to tissue damage. Encourage gentle, pain-tolerable movement and validate their experience while guiding them away from avoidance. And 5. Help patients develop new skills such as problem solving. For example, help them to make a plan for the next flare-up. You can guide patients by asking them if they think they will be in this situation again at some point, and if so, how they will handle it. Also, ask patients to look back and see if they can identify any pain triggers, especially non-physical triggers, so that not only do patients become physically active again, but the mind-body element of pain is also reinforced. Let's put it in practice. Dr. Rodriguez is talking to Lisa, who is 40, has chronic low back pain, and just experienced a flare-up that led her to bed rest for 2 days.
Lisa, you had a tough flare-up. It's understandable to want to rest, but for chronic back pain, complete rest for days can actually make things harder in the long term. Your muscles may weaken, and your nervous system becomes more sensitive.
Oh, I definitely felt stiffer. So what should I have done?
The key is to adjust, not stop. Think of a flare like a speed bump, not a brick wall. Instead of bed rest, could you have tried short, gentle walks around the house or broken up chores with short breaks? It's about pacing yourself.
Even dishes felt hard. I was scared I'd hurt myself more.
I know that feeling, but with chronic back pain, moving with some pain usually doesn't mean damage. It's about finding a tolerable level of activity. If your normal walk is 20 minutes during a flare, maybe you try 5 minutes, rest, then 5 more. The goal is to maintain some activity, protect your function, and keep your body from becoming overly fearful of movement.
So even if it hurts a bit, as long as it's not sharp or worsening, I should keep moving.
Exactly. Listen to your body, but aim to keep moving. This builds confidence and resilience. We'll work on a specific plan for your next flare, focusing on how to adjust activities rather than stopping completely.
To sum up, effectively guiding patients through pain flare-ups is critical for long-term pain management. By emphasizing the skill of activity adjustment over complete cessation, healthcare professionals can empower patients to maintain function, mitigate deconditioning, and break the fear avoidance cycle. This proactive approach fosters patient resilience and leads to more sustainable outcomes.